We're moving now to Gerry McCartney. Gerry is the head of the Public Health Observatory in NHS Health Scotland. And Fiona has talked about evidence, and as a medic, I can't get away from the data. So we know that what we do has evidence behind it, and that's why it works. And Gerry is one of the people who looks at all of this evidence and data and tells us where we are, about the current health status of our children and living in Scotland to inspire us to improve. Thank you very much, Gerry.
Thank you very much. So, as Dr. Calderwood has just indicated, I'm going to try and take you through some of the latest data on the health status of children and young people in Scotland. I will be showing a lot of graphs, so it's quite tricky across 3 different screens, but we'll try and explain them as we go along. So health inequalities, as Gerry McLaughlin highlighted earlier on, is a huge focus in Scotland, and that will become clear why as we go through the data. But just to be clear, we're all talking about the same thing. Health inequalities can be defined in many different ways, but a kind of simple definition that we could use for today is systematic differences in the health of people occupying unequal positions in society. So whether it's across social classes or between deprivation groups, across income groups, between men and women, etc., etc. So it's those systematic differences that are often seen as unfair and avoidable. Oops. There we go. One illustration of this, and it speaks to what the Minister had just told us as well, is this massive difference in life expectancy you see within our cities. So here's the very familiar railway map of Glasgow, with the underground line in orange around the middle. And you can see that the life expectancy in Jordan Hill, quite an affluent suburb of Glasgow, is much, much, much higher than it is in Brigton and the East End of Glasgow. And you could do the same sort of map, and we have done for Edinburgh or Dundee or Aberdeen. And you'll probably know those cities better than I do and know the inequalities that you see day in, day out. But that's the kind of challenge we're facing. I put up this slide to say that this isn't inevitable and this isn't a big disaster, because we have actually managed to reduce health inequalities in Great Britain in the past. So this is one measure of health inequalities that we can use going way back to the 1920s. It's the gap in mortality rates between the best and worst tenth of British local authorities. And you can see that in the 1920s, inequalities were quite high. Over the subsequent decades, inequalities dropped dramatically to a low in the 1970s. And that drop was associated with a wee bit of change in the country, so the rise of the NHS, the introduction of pensions, and lots of economic intervention and industrial interventions to equalise people's life chances. Unfortunately, we've seen that over the last 30 or 40 years that has reversed. And it's no surprise that the income inequalities in Great Britain have tracked that quite closely. So income inequalities, as measured here by the income received by the top 1%, the implication being that the 99% have the rest, has dropped down to the 1970s and then has risen rapidly again. So inequalities in wider society very much drive the inequalities in health that we see. But the good news, of course, is that health inequalities, as a result, aren't inevitable. In comparison with the rest of Europe, we don't do so well. So this is another measure of health inequalities called the Relative Index of Inequalities. And this compares Scotland with a range of Western and Eastern European countries. And you can see that in this measure, for females between the age of 30 and 74, health inequalities are wider than anywhere else, even countries like Hungary, the Czech Republic, and Poland. For men, we're also quite bad, but our Eastern European cousins do a little bit worse than us in Hungary and the Czech Republic, but that's not exactly a source of pride for Scots. So in comparison to the rest of Europe, we're really not doing well in terms of health inequalities. I think I've made the battery run out on this. So I'm going to talk a wee bit about inequalities now in the early years, which is obviously the focus of this conference. And we'll talk a wee bit about low birth weight babies, first of all. And this time series goes back to 1996, and you can see that the Scottish average, as a percentage of all singleton births, obviously it's different for twin pregnancies, the percentage of low-weight birth babies has gone down since about 2004 to 2005, but it's not gone down an awful lot, okay? So it's been fairly stable over that time period. However, that masks the vast inequalities that we see between the most and least deprived in Scotland. So it's pretty much double what you get in the least deprived areas in our most deprived tenth, and all the other areas sit in between. So you see massive inequalities in outcomes right from birth within Scotland. It's not all bad news though, and I don't want to give just a sob story and a bad news story, because if you look at a very, very long time trend, back to the 1950s, and this graph is a wee bit complicated, so I'll just explain it to you. The top red line that's coming down there is the worst, if you like, for the whole of Europe. So it's the maximum infant mortality rate seen for, this is for females, across the whole of Europe. And the minimum line, the bottom red line, is the best in Europe. And the red line in the middle is the mean, the average for Europe. And the yellow dots is Scotland over that time period. So you can see that Scotland starts a wee bit better than average and improves all the way for the last 50, 60 years, such that we've got a much, much lower infant mortality rate for females now compared to what we used to have. The slightly less good message, I guess, is that we started off being better than average. We're now worse than average, and that's true for males and females, where you can see a very similar pattern. So we are improving, but we're not improving as quickly as other countries and nations across Europe. Another outcome that will be of interest here is stillbirths. Again, you can see that the stillbirth rate in the most deprived groups is much larger than it is in the least deprived, but there is a hint there that perhaps inequalities have started to decline in the last few years. We'll need to see for more data to see if that trend continues. Neonatal deaths, again, you see vast inequalities. Although the average is coming down, all those lines are slowly coming down, moving in the right direction. That inequality has persisted over time, and again, the rates in the most deprived groups are substantially higher than they are in the least deprived groups. You can see a lot of depressed faces, I'm sorry. Okay, let's think about as we grow up, as we move on from that. So breastfeeding, this won't be a surprise. Okay, so we see this gradient in breastfeeding, both in terms of exclusively breastfed and mixed feeding across our deprivation quintiles. And that is, it looks like quite a bad news story, but I want to just give a wee hint of positivity here, because although that inequality is there, you can see that in the most deprived, the most deprived groups, you can see that the improvement in breastfeeding rates has been more rapid than it has been in other groups. So there's a hint there that inequalities in breastfeeding are beginning to decline. So that's got to be good news, and it might take 10 or 20 years for the results of that to be shown, but we need to grasp onto those wee positive nuggets when we can find them. So I think that's good news. This graph I want to spend a wee bit of time explaining. I love the colours, and it's like a rainbow here. But what it shows is when children get their immunisations, and this one is the DTP polio. I can't remember what HIB stands for. That's terrible. I used to be a GP. I used to know all these things. What does it stand for? Haemophilus, is it? Oh, I can't remember. Right. I'm quite embarrassed now. So this graph tells you when different groups, different deprivation quintiles in Scotland get your immunisations, okay? And the green line, that's the bottom line here, is the most deprived group. And you can see that they get their immunisations just a wee bit later than the most affluent groups in Scotland. But there's a really good news story here, and I think it's testament probably to all of you, is that those lines end up in the same place. So the inequalities have been eradicated by the time to get to a year old. It's just that it's much more difficult to get the immunisations for the people in the most deprived areas. So we get there in the end, and that's testament to all that hard work of health and social work and everybody else. But that inequality does appear briefly as we're trying to get people into services. Very similar pattern for the MMR first dose. Again, this is quite recent data for those children born in 2012. You see the same pattern. So as soon as people are eligible in the most affluent groups, the uptake's really, really quick. But for the more deprived groups, there's just that small delay. But we get to the same place by the end. The graphs converge after about 24 months. So I think there's a good news story in amongst that kind of worrying trend. Okay, here is a real worrying trend though, and this is about childhood obesity. So this is primary 1 children. It looks a wee bit worse than it actually is. So the dotted lines are projections, so you can kind of ignore the dotted lines. But the solid lines, the red one at the top, is the most deprived group. The green one is the average for Scotland. And the blue line at the bottom is the least deprived group. And this shows the prevalence of obesity for each of those. And you can see that back in 2001, it was almost the same across those groups. But by 2012, 13, thereabouts, the inequality has just appeared. And this is kind of a new inequality for Scotland. If you look at adults as well, back to 1995, there was no inequalities in obesity in adults, but that inequality has rapidly and quickly grown to quite a vast inequality in obesity. And again, that may well store up an awful lot of problems in the future around diabetes, heart disease and such like. So we're quite worried about these obesity trends. And obviously there's a lot of work going on to try and prevent obesity and to do more to manage it. Okay, another sort of positive thing here is about child poverty. Now, this is a different measure of socioeconomic inequalities. I showed you earlier the income inequalities as measured by the top 1% share of income, and that was going up and up and up. But child poverty measures have come down. Interestingly, that before housing costs, obviously child poverty rates are lower, and that's because of the particularly high housing costs faced by our most deprived groups. But the worrying bit is that flick up at the end. And I don't think it's going to be any surprise to this audience what some of the causes of that might be. So we're seeing a massive impact of so-called welfare reform at the moment, welfare changes, and that includes increases in sanctions, more conditions to get benefits, and the actual real value of benefits going down. And that we know that that's impacting more on women, we know that's impacting particularly on lone parent families. And so those rises in poverty, we're very worried will actually increase into a real negative trend. And obviously that's going to drive inequalities in the future and drive a lot of problems. And notwithstanding the mitigation that the Scottish Government has the power to implement, there's obviously a lot of this coming from other jurisdictions. I just want to say a word before I finish about the Children and Young Persons Act. And partly because I'm from ScotFo, the Scottish Public Health Observatory, our main job is to inform people with data and evidence around outcomes for Scotland. And we know that the Act has asked a lot of people to report on the well-being of children in their areas annually. And so there's a lot of people a wee bit anxious about how they're going to do that and what data they're going to use. So I just want to make you aware that there are a number of resources available. So we know that it's likely that we're going to be asked to report on measures across the Shinari framework. And I've put them all there in case I forgot what some of them stood for. We know that there's a number of us working together to provide a sort of range of support. So if you are in charge of children's services or reporting for your local authority, again, we'll have support available later this year. To be aware of this as well, there's a review ongoing at the moment about children and young persons surveys. We know that the landscape, particularly for school surveys, is quite cluttered at the moment. So we're working together with all the commissioners of the different surveys to try and come up with a clearer plan about how we survey our children in the future. And we've got a big event on the 18th of June, so it's a bit of a plug for that. Contact Rudy O'Brien if you want to come along and help us design what that future survey landscape will be. But we have a number of data tools already available on our website, and that's the link there. And just to note that the data I'm going to show you is thanks to your diligence, because a lot of it comes from routine data systems. And I know that when I was a GP, you'd fill in the child health surveillance forms, whatever you think, I'll never go see that data again. It just goes into a black hole somewhere. Well, actually, we use it, and I'm going to show you it, so please keep doing it. And it's only thanks to your diligence that we have these data and that we know what's happening to outcomes. So here's just one example. This is for Edinburgh Community Health Partnership. It's a children and young persons profile, and it gives about 60 different indicators of health, and it shows you whether it's better or worse than the Scottish average. And you can now compare yourself with different areas. So in Edinburgh, if you don't want to compare yourself with Scotland, you can compare yourself with the Borders, or you can compare yourself with Lanarkshire, or wherever. And you can also get the data right down to intermediate zones. That's areas of about 10,000 people. And here's one for Curry, and you can see that. And sorry, you'll not be able to see this all the way. Oh, I've got there it is here. You can see that most of the dots for Curry are on the right-hand side, which means it's better than the Scottish average. Compare and contrast that for Moredun. This was picked more or less at random, but Moredun, all the dots on the left-hand side, which shows you that those outcomes are worse in that area. And so you can do that for all areas across Scotland. Look at your local data, try and plan and design your services to meet your local need. Okay, so just to summarise, there's lots and lots of outcomes for children and young people that have been getting much, much better for the last 60 years. And we need to take credit for that, say, we've all played a huge role in achieving that improvement, and we need to be really proud of it. However, inequalities remain very, very wide, and in some measures are increasing. And a lot of the failure to keep up with the European improvements are because we have wider inequalities than elsewhere. And it's only through improving our inequalities that we'll actually be able to catch up. I think the hard work of all the staff across the NHS, education everywhere is quite evident in these data, and I think the immunisation data speak really closely to that, so well done and thank you. But the Children and Young Person Act brings an added focus and opportunity, I think, for greater work in this area. But we know there are huge challenges ahead with the rise in poverty, welfare changes, and the public spending squeeze that's still there. Thank you very much.
Gerry, thank you. The data's fascinating. I hope you'll send me your slides, please. And Gerry has obviously highlighted some areas where we've improved, and as he said, though, there were a lot of depressed-looking faces in the audience, but Gerry, I can update you on stillbirths. So we took, the Maternity and Children's Quality Improvement Collaborative took the terrible data in Scotland on stillbirth, one of the worst performers in Europe, with a very high stillbirth rate that hasn't changed for 20 years. But we, in maternity services, and many of my friends are in the audience, didn't accept that there was nothing we could do. So we set an aim of reducing stillbirths by 15% by 2015. Only gave ourselves 2 years to do it. And I stood in front of audiences like this with people with their hands on their hips and their arms folded. Catherine, where did you get that number from? 15%. That's ridiculous. It hasn't changed for 20 years. And I said, I chose the number because I think we can do it. I may be wrong, but I'll stand up in front of you and tell you if I'm wrong. And I've stood up in front of them and I've told them that I was wrong because the stillbirth rate has fallen by 18%. In less time. And by the end of 2015, I think we will be even better. So we took something that people believed wouldn't change, we refused to accept it, and we have less babies dying and less neonatal deaths as well. In Scotland, better than England, better than Northern Ireland, better than Wales, the lowest stillbirth that's been recorded since 1992. So it can be done, so the depressed faces can smile, and Gerry's data is data for improvement, so we use it to learn and to improve. So thank you very much, Gerry, and to all of you who've collected it for Gerry to use.